Hi, my name is Greg Leon. I'm a director on the programmatic team at PHM.
So Greg, we're going to be talking a little bit about CTV today. I understand that a lot of your team is focused on this channel. What's really interesting to me is how CTV is really like the opportunity to connect with your audiences and your consumers, as well as the doctors. And again, it's taking on like this new approach to scaling. It's linear TV is kind of converging with connected TV, the blurred lens between the connected household to the linear connected household, what sometimes referred to as the hybrid family, as opposed to the cord cutters, right? The people that have jumped out of linear TV altogether. But now even a step further, we take it to programmatic, where you have the ability to layer on data, inform kind of where those ads are going. Now, how do you think about that, Greg?
Yeah, I mean, it's definitely a division of labor that has converged a ton over the past few years. As you mentioned, there's the cord cutters, and that's kind of what has been discussed for the past decade now, of going into the streaming era versus the linear era. It was previously seen so separate and so differently. CTV being something that can be done programmatically, but can also be tacked on to a linear buy. What do we do about that? How do we manage that difference? How do we make sure that everything is working together and there's not too much overlap? So leaning on our video teams to have more of the strategy arm and working with us as programmatic teams to have that activation arm. Now, like you said, it can run in all these different ways. There's all these different entry points to get to your audience, to reach your audience on CTV, linear TV. A lot of that comes to, we rely a lot on our partners, whether that's the inventory partners or our DSP partners, such as DeepIntent, to provide us with the proper way to reach our audience and understanding how we can layer on data on our end to either differentiate or support whatever is happening on either side of the fence.
So you think about that, the linear dollars have come in. The idea was we had to scale to a demo. Now we can think about this holistically as a healthcare marketer, bring in the health intelligence, provide that into the actual media buying across CTV. Do you see it kind of moving away from a programmatic guaranteed world to more of a open PMP world? Or do you still feel like the deals are still being kind of secured up front? We have to work in that.
Yeah, so a lot of what we focus on is very decision buying. It's very PMP focused. We try not to commit too much because when you are running CTV programmatically, I think one of the big advantages of that is being able to layer that data on and to see what happens real time and to reach your audience wherever they are at the right moment in the right streaming space. So with that in mind, committing dollars up front, while it might be right for a more general demographic type of buy, if you're going into a data-focused and much more narrow audience, you really need to be nimble. You need those dollars to be able to spend wherever they are. Which part of that I'd like to get to later is once you're working with an audience like that and it is restrictive and it does need to run wherever that audience is, it makes it really important to have scale, but also quality. And that's where the balance gets a little bit tough.
So if you're in this PMP space, you're using addressable data to inform decisioning up front, which I can totally appreciate. What are the solutions that you need to see in a platform to be effective in getting the job done for the customer and getting what you need to get done for your team? What are some of like the must-have like capabilities that you think inform the decisioning?
Yeah, I mean, first and foremost with programmatic, it's so much of it is audience first. Audience is not the only type of buying that we do, but you have to have that strong audience graph, especially if you're going to run CTV to an HCP audience. Things get really restrictive there. We have really tight, narrow audiences that our clients want us to reach, and we need to be able to scale that. And so matching as high as possible and reaching those users on any device that we can, that's really important. Real-time measurement and insights is important. Being able to manage budgets fluidly. One thing especially I think is frequency capping. And I think that's one of the really great things that programmatic is able to leverage over the direct IO version of buying, in that if you are committing dollars to various different video partners across the landscape, they're not talking to each other about how much is running against their audiences.
Of course,
It's running, it's going, that's all there is to it. So when you're able to take those inventory sources, layer them all together, slap an audience on top of it, and then with your DSP say, wherever these people are, we want to reach them, but only this many times or at this cadence. And it doesn't matter where they are. They can be on ABC, they could be on Paramount, wherever it is. Keep tabs on them. And having everything unified and centralized in that one space of a DSP, that frequency setting, I think, is really crucial and one of the major advantages that we have for that method of buying.
Got it. And are you, when you're doing your CTVs, are they tied to an omnichannel experience, maybe using a sequential messaging or some sort of retargeting strategy?
Yeah, absolutely. I mean, working with DeepIntent, we get plenty of data. We're able to, have pixels placed, have everything tagged across channels, and therefore have different channels interact with each other. Reach people based on exposure of our own ads, reach people based on exposure of competitor ads, have that all work together and inform each other.
Given that you have the traditional investment team in the room, you're bringing the programmatic intelligence in there, how do you guys approach it differently? And do you find aspects of it, more suited to programmatic or more suited to the investment side? And if you think about double clicking into that, live sports seems to be the conversation of the day.
Yes.
It always felt like that was the investment team is only going to work with live sports. We're now in a world where, Peacock will come to us and say, hey, the Olympics is available programmatically.
Yeah.
Like, comment on that.
Yeah. I mean, that is something that we were majorly able to capitalize on, but not without a lot of discussion and a lot of strategic conversations with our video investment team. It's been a learning process to understand how sports can work programmatically. For example, the Olympics are on constantly. So there is plenty of inventory that we can leverage there. I don't want to say regardless of what audiences we have, but the audiences that we had were able to reach plenty there. On the flip side, and contrary to our predictions, NFL was tough. I think NFL content is so restricted and so highly coveted that it was really hard from a programmatic standpoint to achieve the scale that we wanted to there. Now, none of this is to say that this is what we will do and this is not what we will do, but I think it kind of helps dictate that division of labor and how we collaborate with the video investment team. So, if a client says they know they want to be in NFL and they know they want to be at a certain game, they want to be a part of this matchup, they want to be on Sunday night, that's something that might be a little hard for us to achieve. We can't guarantee that. Video investment can guarantee that, but you know what? They can also tell us these are the publishers that we are prioritizing. Here's who we're working with, and maybe they'll let us know this is all that we were able to secure. We want to supplement that. They may also tell us we are tapped out at how much reach we're going to have with this publisher. Go elsewhere. And it's become something where, as long as we're discussing and as long as we're having those conversations at the beginning of our campaign plans, we have a pretty good understanding, and we know that we can be nimble and change things whenever we need to.
So I've always felt like the NFL experience was like the true sports primetime experience.
Yeah.
Right? Just a few years ago, I'd be on my couch, I'd turn on cable and I'd watch it on ESPN. And then about 2 years ago, I couldn't find it and realized it was on Amazon Prime. But with Amazon, you kind of come with, again, that kind of investment feel. You're still not seeing like the transition towards like the programmatic. But in other areas, there are opportunities where it's like a much more programmatic experience. I think the MLB and the NBA have definitely like classed up into the programmatic world. How do, to your point, we're talking about patients, but the doctors are also in their blue jean moments. Are you finding them in also in these aspects of sports, and what's that been like?
So HCPs, we've been absolutely trying to capitalize on from a CTV standpoint. The entry point to programmatic is display, and there's always that HCP focused message. Going into CTV, it's rare that a manufacturer's marketing team will, it might not be worth their investment to create a CTV spot that is specific to HCPs. That's seen as a barrier to entry, and we are working with our clients to kind of flip the script on that. We want them to understand that, if their patients are coming in to ask them about a certain treatment based on what they've seen in their experience, we want the HCPs, we want physicians, we want nurse practitioners, we want physicians assistants, we want them all to be in the know and understand the same messaging that have been seen by the patients that they are discussing their matters with. When it gets into, I will say, when it gets into sports, I think we're breaking through on the consumer side of that. We haven't quite tapped that on the HCP side.
Yeah.
I think that's sort of the next step there of not just saying, hey, we're targeting the patients, we're targeting the HCPs, they're being reached, but where is it clicking with them?
So I wasn't always in healthcare. When I joined DeepIntent back in 2021 was actually my entry point into healthcare. And one of the first things that I discovered here is, wow, I have the deterministic capability here to reach one-to-one the person that I need to talk to on the other side of the glass. And we still don't think about the opportunity to create that story specific for your doctor. Too often I hear clients tell me, well, we're going to use the patient messaging to target the doctor because the benefits are there, the healthcare insights are there. It's
Sure.
kind of the same thing. At what point do we see, or an inflection point do we see where we start to message directly with CTV, one-to-one, with like, again, communication that speaks to that doctor? And then to your point earlier, like the entry point for HCP has been display.
Yeah.
But people don't respond to display if they don't have the awareness, the recall, and the intent that is developed through video.
Yeah.
Right? Sight, sound, and motion is where we learn things, we pick up things, we share things. So at what point do we think about programmatic more as the marketing journey, the funnel, again, one-to-one marketing at scale against like the audiences that we want to try to reach? We have all these opportunities there. When do we start to implement more of that?
Yeah, that's a great question. And it's hearing your experience there is, it speaks very truly home to me because I entered the pharma world when I started at PHM in 2022, year after you.
Gotcha.
And I remember working on HCP campaigns. I kind of knew the idea of, yeah, we're going towards consumers as well as doctors.
Yeah.
But when someone told me, here's the target list, I'm like, what's included in this target list? It's the doctors. Where did we get the doctors? The clients gave them to us. It's that simple. Like I couldn't believe after going through DSPs and just looking for what segments are available to us off the shelf and hearing that the clients just gave us the answer. It really is pretty incredible.
Yeah.
And it's great that we have technology that's able to match that up and have, HCP identity graphs like DeepIntent has. But you're right. The entry point there really is, it starts with display. And I think there's more that we're trying to break into even from a display standpoint. And then I think about where we are from HCP and video for doctors and how I wasn't involved in pharma at the start of display advertising to HCPs, but I see it starting for HCPs now. And I'm thinking, yeah, there's more that can be done here. So with display, I think when it comes into more than just target lists and becomes something of like an omni-channel approach, not just from a targeting standpoint, but looking at omni-channel signals, whether that's rep calls, email responses to inform what that messaging is that doctors will see. I do wonder when we'll get to the point of videos there being done, at least from a CTV standpoint. I've discussed a little bit. I feel like we haven't gotten it quite off the ground from a programmatic standpoint, but more of the long form content, such as key opinion leaders for HCPs, which I do think is really interesting. But I think that's what's tough there and a bit of a barrier there is that's the content we want to drive to.
Yeah.
Whereas I'm not sure if that's necessarily what will catch someone's attention while they're, on either an endemic or a lifestyle website. So I think maybe working there, it's kind of starting there. There's this dedicated content that you have that isn't necessarily for advertising, but for the people that are interested in make it to your site or make it to your socials. How do we take that, find the so what of it, and put that up front before users are even aware or considering your brand?
Yeah, I think creative storytelling for HCP needs to fundamentally come up.
Yeah.
Great. So Greg, as we wrap up, looking ahead, how do you see your supply strategy becoming a real differentiator between top performing brands and everyone else?
Yeah. That convergence strategy that I mentioned before, I think that really is the key. It's not looking at your programmatic video versus your direct video. It's looking at it holistically and understanding what it is that you want to achieve, where you want to be, how you want to reach your audience, and then understanding which approach you want to take throughout the campaign. There's no one size fits all there. The supply that we implement, the strategy that we have there, that really takes multiple teams to look into that. That comes from the client direction, knowing what sort of content they want to be in. If there are tentpole events that matter to them, if we are supposed to be surrounding those tentpole events, and that strategy really, it goes to programmatic, but it really flows in with the video buying team because they know that space.
Yeah.
Programmatic is not a channel. We are a method of buying that enhances other channels. And not to go outside of CTV, but point of care, EHR, it's all coming over to us, digital out of home, and it's super exciting. But at the end of the day, there are teams that have strategized and been really intentional about what they've done here. So for it to come straight to the DSPs and straight to the traders has me a little bit nervous. And that's why I'm glad that we still have those teams and I want to work with them to understand how do we be intentional about the supply that we're working with, you know? How, in your experience, where have you seen, you know, the most efficiency, the best reach, the best quality, the most trustworthiness? And then we can, based on that, decide how everything is purchased and kind of that division of labor. This is something that should be secured. This is something that we need to make sure we reach our audience on in a more efficient manner. Yeah. So that marriage of scaling out the content, but being intentional, making sure that it's quality. It's a programmatic team that activates that, but it's a full funnel approach and a cross collaboration approach to really get that right and strike the right balance.